I'm interested in knowing your thoughts about your beliefs, behaviors, or feelings as someone who is involved in care for patients. Thanks for doing the survey. The survey looked at 14 attributes considered crucial to an efficient system. During our interview, we'll be talking about only 2 of them: legislation, regulation, and medical direction. So legislation and regulation is 1. It refers to either the Ministry of Health, Chief Medical Officer, CDEMA, or even an authority who has jurisdictional responsibility to serve as the lead agency to coordinate EMS activities locally or across the Caribbean. Both legislation and regulation could require activities among various agencies to be integrated in order to facilitate a Caribbean-wide standard for EMS systems. It also refers to the implementation of laws that provide protection from liability for EMS providers, and also medical direction for the personnel when dealing with unusual situations, agencies, and could serve as liaison that interface with other entities in the Caribbean. So let's get started with some questions about legislation and regulation. Tell me about your beliefs regarding the emergency medical services system and patient care here in Barbados.
Well, belief as in what I think about it, my observation.
Mm-hmm.
I believe it can be very much improved.
Mm-hmm.
Meaning as in terms of resources, staff, because for instance, sometimes when you got persons come, even if they may not have come by the ambulance, they may have come from a relative, so they come from the outer waiting area. Sometimes if they're not ill, yes, they gotta go back home and sit due to lack of space and availability of beds or chairs or what's not. But like, if there's not enough, sometimes those patients, there's still patients out there that are ill, but you don't have the staff, right, to make sure those persons are re-evaluated, even if they have had some kind of medication from triage or what's not, to go and see if any improvement, if they have gotten much worse, that they will become an emergency patient that needs to be seen by a doctor immediately. So I think it is good that patients have somewhere to come, but it still needs to be at an acceptable standard that even though they may have come ill, they don't leave worse than they would have come when it could have been avoided.
So would they come by ambulance or not? That's what you mean.
I mean, even if they come by ambulance or not, if someone comes from an outer waiting area and it's an emergency, they're seen right away. But I mean, sometimes even those that come for the ambulance, if they're given something or you triage them, notice that there's some person that can be based on others, they too can go in the outer waiting area. But I mean, there need to be somebody out there that will go and re-evaluate these patients because they're still out there. They can be forgotten because they're not in a sight to see if something happens. If somebody comes in as an epileptic start to have a seizure, you only know by somebody in the waiting area coming and say something, or have a patient advocate or somebody literally see something. But I think there needs to be something in place that will allow persons to be re-evaluated, so then that persons don't stay there and become worse than they came, but they're still not being seen because you're probably thinking that they're still the same way, or there's no one, or it's so hectic that you're not able, they're forgotten. Yeah.
So what do you believe is the role of legislation and regulation as it relates to pre-hospital EMS providers in Barbados?
I think that there should be making sure that those persons are always currently up to date with new research, new things that come about. If they decided, well, this is not something we do anymore, that they're continuing education for those persons, also making sure they have the available resources and staffing as well that they may need to do their daily work. Also making sure that they have protocols and procedures so they will know how they need to operate based on conditions of patients or how they may find someone.
So you believe do you believe that legislation and regulation are important to the success of the EMS service delivery in the pre-hospital in terms of delivery, patient care, and patient outcome?
Yes, I do.
Okay.
Because they are the ones that, again, give the availability of resources. So a lot of patient care and outcome based on your resources, what you have available to you to diagnose, the diagnostic procedures you need to be done to be able to accurately and timely diagnose someone. So I believe they have a role in that, to make sure that there is availability of resources so that the doctors and nurses can be able to use them to assist the patients in their care.
Can you provide me an example of where you think that legislation and regulation may have impacted the care provided by pre-hospital providers that showed up in your A&E? So do you have an example where you believe that legislation and regulation impacted the delivery of care that someone received from the ambulance providers that were brought to you?
I would say probably in terms of the scope that the pre-hospital emergency services are allowed to do. So they are only allowed to do so much. For example, if you have a patient, patient unresponsive, take a blood glucose level, realizes the person is actually hypoglycemic, but then is that none of the two are able at that point to, their scope is not to put a AV access or administer glucose, so which means that person has to wait until they get to the emergency room for IV to be put up for that shows to be given. So in that case, it could impact a patient because depending on the distance they're coming from, well, here it's not really a long distance, but that's still 15 minutes when the patient is in a hypoglycemic state.
Yeah. So when you think about that, have you had that specific scenario before?
Yes, I have.
Okay.
I think it's so fresh in my mind because it happened last week.
Last week. Okay. So what are some things you think that influence how the A&E nurses, or even the doctors or pre-hospital provider, about their feelings about EMS and legislation? What do you think are some things that influence how they feel about legislation and regulation?
Some of the things I believe will be in regards to when there's so little staffing to so many patients to be seen, and every shift that comes, you just have patients rolling over all the time, so you're not able to adequately see the persons in the time frame that you would like to be able to give them care. Those that could just be reviewed and go home or referred to primary health care, you could just see those quickly. So I think a lot of it is to do with the resources and staff, as in not able to see the patients as you would. So then it puts strain because you can only have the staff if those in charge put that in place, and also the resources once you're getting the adequate stock that you need in the department to do the procedures and
So how do you link that to legislation and regulation of pre-hospital providers? How do you link what you just said to those feelings about legislation? How does it connect?
I mean, for the pre-hospital workers?
How do you think your feelings towards legislation could impact them, or
maybe it could be that maybe if they come with a patient and something is not done, you may just take out your frustration or anger on them, because patients are coming but no one is actually moving anywhere, and you may take out what's going on them, but they're basically dealing with the same issues that you are. So then it causes it to have a little, I don't know if you would say animosity or cause division, because you're being hostile toward them, and it's really
Right. So I want to know a little bit more about the feelings thing. Would you characterize your feelings as being negative, indifferent, or positive as it relates to any legislation or regulation of pre-hospital providers?
influences positive. I have never had a encounter or anything to describe it as negative.
Okay. So when we talk about behaviors, you mentioned behaviors, hostility earlier. And what do you think that stems from in terms of how does legislation and regulation influence behaviors of you or your peers regarding EMS providers?
I think it. I think it influences, as in, not that you blame the other EMS providers for what's going on, but that it comes out as more as frustration, I would say.
Okay.
I don't think it's that necessarily is that there's like a big conflict or disagreement, because we are all providers for the emergency service. So at the end there, we all kind of back dealing with the same issues that need to be resolved.
Okay. Now let's move on with some questions about medical direction. Medical direction refers to the Caribbean country having a qualified EMS medical director. Okay, one who oversees the country's EMS system and provides guidance to all providers. It refers to sometimes an appointment of an EMS medical director for a particular country. It often requires involvement from clinical care, system design, scope of practicing, or scope of practice, credentialing, population-based care, occupational health of providers, and encouraging and initiating research. Can you tell me about your beliefs regarding medical direction that's provided to the pre-hospital EMS providers? What are your beliefs regarding that?
Well, I honestly not sure if I can answer that question, because I don't really know what is there outside of me meeting them with the patients. I don't really know what is there, what their
Understood.
Is their procedure, if they have someone over them that they relate to.
So you're unsure about the medical direction that they actually get. So in your mind, based on the definition that I've provided, do you believe that EMS medical direction is important to those pre-hospital EMS service providers?
I also believe it's important due to the fact that then they have a sense of someone in charge, and then everyone is going in the same direction as regards to practice, to knowing what are the protocols, what are the procedures in in certain situations, and so everyone is basically under the same umbrella. Everyone has an idea of what is their role and what is expected of them.
Right. So understanding that the medical direction aspect, you're not too familiar with that, but let's just kind of look at it this way. The definition that I provided, what are your feelings though regarding medical direction being provided for them? You kind of talked about it a little bit, but what makes you feel that way, that it's important for them? Because you suggested it may be important for them. So what makes you feel that way?
Well, I believe that I feel like it would be very important for them, because like that persons, from the time they meet a patient doesn't have to wait until they get to the emergency department to begin having care, but they'll be having care from the time they come in contact with a healthcare professional. So having a medical direction or director, a person that's in charge, everyone would have some kind of direction, know what is expected of them, and also know what procedures they are to perform, be able to do it so that the care of patients can be maximized.
Okay. So when we talk about those thoughts that you're talking about there, in terms of behaviors of any doctors, any nurses, or even ambulance workers in Barbados, what are some things you think that are influencing the behaviors of nurses that work in A&E, or even physicians who may be involved to some degree in medical direction? What do you think are some things that's influencing their behaviors?
Some things that influence their behaviors, I would say, probably overwhelmed, probably some days overwhelmed. Sometimes it could be hostility from both patients and relatives towards the healthcare providers. Sometimes it could be, I guess, lack of appreciation from those that you are training to assist or help.
Okay. So, in terms of your actual behavior as a stakeholder, as an A&E nurse, and as it relates to your interaction, how do you feel that? What are some things that's influencing your behavior from that perspective?
I would say things influencing my behavior are, I look at things from a side as in, some persons are, if I had a relative that was ill, or say, I'm not saying that I would be hostile or disrespectful to others, but you can understand when someone is ill that they will expect the best care for themselves and also their relatives. So I look at it as a point that it could just be out of worry. So I always have a positive attitude to others. I don't take hard feelings. If a person comes at me and they think they're kind of being a little hostile or whatever, just reply differently to them. Just keep it professional, and so I think I don't allow those things to influence my behavior towards someone.
Okay. And when you say someone, are you talking about the ambulance workers or just the patient?
Workers, nurses, doctors, patients, their relatives.
Okay. Yeah. All right. Are you able to tell me about a particular time when you think medical direction may have positively influenced the behavior of yourself or your peers or even the ambulance providers?
Repeat it one more time.
Can you tell me about a particular time when medical direction may have positively influenced the behaviors of yourself or doctors or pre-hospital providers who you interacted with?
I would say probably the times when they have like what you would call them, like teaching sessions, or they would just do like drills so that they make sure that everyone is prepared or knows what is their role or what the roles are for when there are actually emergencies that come in. Say someone is in cardiac arrest, having continuous seizure activity. So I would say probably the teaching sessions and the drills, allowing everyone to know what is their role and what is expected of them.
So like guidance.
Yes,
Guidance. Okay. Well, I think in closing, we've covered a lot. How long have you been in the profession as a nurse?
As a nurse, 3 years.
3 years. Okay. And how do you like what you do?
I love it.
Okay, good. We've covered everything I plan to cover. Is there anything else you'd like to add that I might not have asked?
Not that I can think of.
Okay. Well, thank you very much for participating, and I appreciate it.
You're very welcome.
All right, good.
Yes,